Thank you very much. So my full name is Ivan Dynamo De Jesus. Dynamo is my middle name. Also makes me feel like a superhero. So you're welcome to call me either one, Ivan or Dynamo. All right. So the topic here is healthcare. But the reason I put the subject line as the future of health is because healthcare as we know it is going to change. So what are we going to cover? We're going to cover data and the rise of AI in healthcare and look at exactly what Moore's law and how it applies to healthcare and really the amount of data that we have and how that's going to facilitate healthcare and ultimately how we live our lives and our health and longevity. AI and diagnostics and how if you think about X-ray machines, MRIs, the stethoscope, how all of those innovations have changed how medicine is practiced and how AI is going to exponentially accelerate that and empower our physicians. Personalized medicine and drug discovery and what that means for us individually and by when. Technology and treatment and delivery of care, and obviously the conclusion in Q&A. So I like this quote. It's from Eric Topol. It's a medical doctor, MD, PhD, one of the preeminent minds when it comes to AI and healthcare. And the quote is, "The greatest opportunity offered by AI is not reducing errors or workloads or even curing cancer. It is the opportunity to restore the precious and time-honored connection and trust." How many of you have been to the doctor in the last year, 2 years, 3 years? Yeah? How long did you spend with your doctor?
5 minutes.
Right? And by 2035, there's going to be a shortfall of 400,000 medical doctors in this country. Because after COVID, there is less people wanting to get into the field. So AI, the real power here, is in really being able to empower our medical doctors and our medical providers and PAs, nurse practitioners, and extenders to be able to actually have the human connection that's now lost. So I have this slide from Henrik. This is a presentation that Henrik made. And Henrik, I think you explained this best.
I'm going to try to do this quickly. This is a calculation I did for a presentation a couple of weeks back. And courtesy of Yara who invited me and Grant from GPQZ. And I want to give you a little bit of sense of the size of the capability of AI now and into the future. In 2000, which was 1 year when AI started, the ability to process parameters was basically 1 billion parameters, right? If you extrapolate that to 2025, 25 years later, right now AI has the ability to process 100 trillion parameters. So I want you to realize the amount of growth that happened from here to here. But there's going to be a jump in the next 20 years where it's going to go to a billion trillion, which is basically a very large number, and that number is called a sextillion. As I couldn't figure out what a sextillion was, I basically make a depiction of what this number looks like. By this period, by 2045, AI will have more processing power than all human intellect in the world as we exist by that time. I had a conversation yesterday with a very interesting gentleman, Barak, who's visiting us from Israel. Thank you very much and welcome. And we discussed something which Daniel is going to touch. Between here and here, we're going to have two things. One is called the inflection point. It's basically going to create a moment where the human being and AI are going to become one. Call it cyborgs, call it transhumanism, that's going to happen. And that's going to happen courtesy of healthcare and AI.
Thanks, Henrik. So if you look at this number there highlighted in red, by 2045, the number may look like this. And obviously, that is a lot of zeros. I wish that was in one of our bank accounts. But really, when you think of this number, it's really hard for us as humans to quantify how big that is. I'm going to give you guys an example. You were talking about, you heard Mr. Cohen talk about the dating app where now instead of you talking on Tinder, it does it for you. Imagine you were to spend, or like, you know, that swiping that you do on dating apps. Imagine you were to spend 1 second per human on Earth right now, right? How long would it take you to spend that 1 second either swiping or 1 second with one human, 1 second with another human, 1 second? How long do you think that would take? Right? It's really simple. It's 7 billion seconds or 8 billion seconds, depending on which one you pick, right? If you didn't sleep and you did that, it would take you, if it's 7 billion, over 220 years. If it's 8 billion, it's like over 250 years. No sleep, spending 1 second per human, right? So we just can't comprehend these numbers. And so this is an important, this is why I highlighted in red, because you're going to see something in a second. All right, Henrik, you want to explain this one too? I got it. All right. Yeah.
This is something that when I did the research for the DP Tuesday presentation, I started asking myself a lot of questions. But whoever knows me here, you know I'm always asking questions and asking myself a lot of questions. So what I said is, okay, what is a parameter? How you know, what's the amount of parameters that we have created since we have living things on Earth? And the number of parameters is roughly like this. By the way, I pulled this from ChatGPT, so it may be biased. It says 1 trillion species times 1 billion parameters per species. That's 10 to the 21 parameters. So by 2045, the number that we have on the capacity of AI on its current growth is going to be orders of magnitude larger than all the information that we have since living things started walking the earth. To give you the size of how big that is.
Yeah. So
otherwise, we have no power or energy to fuel that. That's going to be the next topic.
So basically, we're on a new frontier. And how does that affect us in AI? So when we think about data, the first instance of an electronic medical record was in 1976, but it didn't actually get implemented until 2009. And there are still doctors today that still have paper charts and faxes because they're 82 years old and they're still practicing medicine, right? But more and more data is entering electronic medical records. We're getting the full sequencing of the genome of many people across the planet. We're getting diagnostic tests, MRIs, X-rays, and having digital representations of that instead of the old, X-rays that you would hold up or put up against the light. Those are becoming more and more digital. And that data is growing at a compound annual growth rate of 36%. You guys know the rule of 72? Well, the rule of 72 is basically if you take a number like 10%, right, and you divide 72 by that 10%, that's how long it's going to take you to double, right? So 72 divided by 10 is 7.2, right? So it's going to take you 7.2 years to double at a rate of 10% compounding every year, okay? So at 36%, that's 2 years. That means it's doubling every 2 years right now. So when we're talking about the 10 sextillion, that data is starting to aggregate as our computing power is starting to aggregate. This isn't science fiction. This is data, right? And so what does that mean for us? Well, there are challenges. There's data siloing. Right now, one of the things in 2021, there was a legislation passed where a lot of the healthcare tech companies and electronic medical records companies created gates, meaning you could not access the data or you had to pay to get your data out of it. The government obviously put a stop to that. And so now they have to have an API where they have to allow the extraction of the data, right? So, but there's still these silos, and they're still not exactly as seamless, but we're getting there. So that's one of the challenges. Obviously, data privacy. Who's going to own our data? Right now, those of us that have Instagram or Facebook or go on Reddit or have a Google account and, you know, search on Google, we don't own that data. Who's going to own our genetic data? Who's going to own our medical data? How many of you have your medical data? Right? So there's some very interesting things that are happening, and we're on the forefront of figuring this out. So where's artificial intelligence now? So one of the areas of AI that's really exciting. So there's two models of healthcare. There's what's called fee-for-service, which is how healthcare has been done. You go to the doctor when something's wrong. If you have a weird chest pain or you have a stomach virus, you go to the doctor. While you're there, you get your annual checkup, right? And they may give you some antibiotics. They may send you to go see the gastroenterologist. And for each one of those procedures, there's something called the ICD-10, the International Code for Disease. And 10 is the 10th edition, which is what the United States works on. And there's condition codes, and there's a fee schedule for those condition codes. Everything from if you broke your left elbow to if you have a stomach virus to whatever it is. There's a fee for each service. That's called fee for service. As you can imagine, like the CPT code, yeah? Like a CPT code, exactly. So as you can imagine, if you're a hip replacement company, right, and you go to the orthopedics in the city of Miami, and you give them a training in Hawaii on your new hip replacement, they're going to start putting in your new titanium hip replacement. And so that's how healthcare is operated, is that it's waiting for something to break so that you can fix it and so that you can get a premium titanium hip to replace it. Does that make sense? So that's called fee for service. That model is changing. Why? Because right now, healthcare is 18.9% of GDP. And by 2028, it is going to be over 20% of GDP. What does that mean? GDP is the gross domestic product, which means what the entire economy does in a given year. Healthcare is going to be 20% of that. That means one out of every $5 in our economy is going to be a healthcare dollar. And so that's why the government has shifted and is saying, we're moving you guys to value-based care. And what does that mean? It's going to be pushed into a model where you're managing a certain amount of premium, a certain amount of dollars for every insured person that's being paid through the government. So Medicare, Medicaid, all of those government payer contracts are going to value-based care. And that's a mandate by the government, CMS. And so what that means is that in that model, you're no longer trying to replace a hip. You're trying to make sure that person gets physical therapy, starts to go walking. You get them on some type of plan to lose weight so that there's less weight on the hip, so that you're managing that patient. Because the difference is, if those of you who have kids, anybody have kids here? Anybody had teenagers at some point? Yeah, okay, all right. Imagine if you gave your teenager a credit card without a limit and they can just fee for service, fee for service, fee for service, versus you give them an allowance, right? Because in the value-based care, I focus on Medicare. You guys want to take a guess how much the government pays in Florida per member, per patient, per month for a Medicare member? Huh?
Depends on the age, no?
Let's say somebody's 65 to 75. Close. It's higher. It's higher. It's not. He said 1,000. It's higher than 900. You're going down. So, 1,200. Yeah, it's approximately 1,200 in Miami. It's a little higher, and based off of adjustments. If somebody has hypertension, diabetes, it could be 1,800, 2,400, 5,000 if somebody's has renal failure, right? And so that's what you receive monthly versus on fee-for-service, they're charging even more than that average amount. So what Medicare is trying to do is trying to standardize how much is being paid per month and then pushing that into the private sector and saying, look, if you spend more than that, it's on you. Everything is going to that model. The government is no longer going to take the risk of having a teenager with a credit card, okay? And so why is artificial intelligence and diagnostics, why is it going to get implemented? Is because, trust me, I work in private equity and finance, venture capital with Henrik. Trust me, there's going to be watchdogs making sure that things are done correctly. And part of this is being able to catch things early. That's why I believe in it, because it's incentivizing management, proactive management versus reacting, right? So skin cancer detection. AI currently, today, is showing that AI models achieve an accuracy of 90% in skin cancer detection. 90%. And we're still in the early days, right? Yes?
Is that using like computer vision?
Computer vision, yep. That's exactly right, yes. Right now, abnormal radiographs, 72.3, and virtual primary care, in terms of conditions, the doctors currently that are using AI for top-ranked diagnosis are taking 60% of the suggested diagnoses. So that means more than half of the time, what the AI is suggesting, they're accepting as the true diagnosis. So now we're talking about individualized care. What does this mean for us as individuals? I don't know why Ron, Joseph, and Sally, even though they're individuals, all happen to be hipsters, but we'll move on from that. So personalized medicine and drug discovery. So you guys heard of CRISPR? CRISPR is clustered regulatory interspaced short palindromic repeats. And so right now, sickle cell is being cured by using CRISPR technology, what's basically what it is gene editing. It's really expensive right now, and they're only doing it on young adults or really teenagers because to be able to make the value worthwhile for the longevity of the person's life. But there's some amazing things happening with CRISPR, and then ultimately drug discovery. As we get more and more genomic sequencing, we can run simulations to be able to see the virtual molecule modeling using genetic data at scale. So we already went over this. This is the fee-for-service versus value-based care and applications of AI. So these are all the different areas where there's a few that aren't mentioned here, but these are the primary areas where applications in AI and healthcare are really at the forefront. All right, just leaving that up there for you guys to see. Okay, so I am doing a couple of different things. You guys can connect with me on LinkedIn by taking a snapshot or connecting there with that QR code. I am currently doing a healthcare roll-up where we're acquiring medical facilities here in Florida. We're currently in process of closing a group that has 17 locations in the central part of Florida. Medicare patients, so people, patients 65 years old and older. The group has approximately 24,000 plus lives. We also see approximately an equivalent amount of Medicaid, commercial, Affordable Care Act marketplace, what's known as Obamacare patients as well. And we're prepared to acquire another approximately 60 facilities throughout the state of Florida and grow that number to approximately 60 to 70,000 Medicare lives and probably an equal amount of other commercial, Medicaid, and other standard patients, because we want to be a test bed for these technologies. So we'll have brick and mortar facilities, real life patients, and then with Henrik, Henrik is an amazing guy. I mean, if you guys don't know Henrik, if you just know him in passing, I mean, he's had 14 exits, 2 of them into public companies, and oh, by the way, next week he's going to go get his PhD in space innovation over in Europe. So Henrik is an amazing guy, and I'm very fortunate to be partnered with Henrik. And if just as impressive, or we will both agree probably even more so than any of us, is Dr. Olivia Scheller. She's the head of strategic partnerships at Bayer Health, and she's soon to retire from that role to be full-time with us. So AXEN is that group that's acquiring the facilities. Future Fortune Fund is a venture fund that Henrik, Olivia, and I are working on that will focus on biosciences, healthcare tech, and AI in healthcare. And then my original backer for AXEN is Impact Invest Corp, based out of Coral Gables, started by Bill Burdett, and it's a $2.5 billion IDC fund where it's essentially risk-free money, managing bank money, and then has a venture side. So we do all kinds of impact investing there, and I work with Michael Selinger on that. And I also have the pleasure of working with Valentin Schmiedoff, who's an amazing individual and an awesome surfer. So thank you very much. So value-based care is really about managing the data of the patients and the actuarial tables that will tell us at the population level what it is that is going on with the patients under our care, right? Like there are certain indicators of if a person has a certain level of blood pressure and is obese and has a certain family history, we can anticipate certain things that are going to happen to that patient. And so how do we get that data in an actionable way for our clinicians, right? So right now, this group that we're acquiring has grown organically, and they're using Excel spreadsheets, right? And so, so how do we, right? Like everybody here is like, oh, they're doing what? Right? And it's a $100 million revenue company. So it's not, but they're not necessarily technologists. And so when we have an actuary and a data science team be able to map out and then use aggregated data that we know based off of the demographics of these individuals and this age profile with these conditions, CPT codes, ICD-10 codes, be able to know, okay, the probability of this person having X, Y, Z, doing these tests, and being preventative and predictive. And so there's certain things that are lower hanging fruit than, let's say we were to get genetic tests for everyone in our group. Well, can we own that data? Like, okay, so yes, we can use it for obviously their medical care, but how do we store it? What is the liability, right? How can we? Yes, and so there's certain things that are being solved already. And so we, like any business, we have to prioritize kind of the lowest hanging fruit. Like the first thing is using the population health is what it's called for data science to be able to use the predictive engines, right? And so there's but there's a lot of, it's kind of like Bitcoin when you were a decade ago, when you were there was 3 or 4 regulations, right? There's still a lot of opportunity to innovate, but also the regulatory environment is still very delicate. But it's also very difficult because of HIPAA and other regulations. Yeah. So I want to answer his question, and then I'll move over here. Yeah. So remind me your question again.
Yeah. So from what you've observed, like when it comes to these like really, that AIs that are advertised to have incredibly high accuracy on, on identifying different diseases, do we tend to see a correlation with more false positives as well?
Yes, potentially the AI could create false positives. From our clinical perspective, same as what was being said in terms of from an attorney's perspective, you ultimately have to rely on the clinician. You cannot diagnose based off of what an AI does alone. So you need a licensed medical doctor to be able to fully sign off on any true diagnosis. So at best, what it can do is flag, and even in the case of a false positive, there would still need to be a clinician to do that kind of that last mile of the verification.
Okay.
So yes, there is that inherent danger, but that's one of the safeguards when it comes to medical care, is that the doctor's ultimately the decision maker.
And where's the primary time-saving measure in utilizing like AI identification for a lot of these diseases?
Well, part of it is being able to aggregate the data and be able to showcase it to a medical provider with some already digested information, so that they can do an analysis of the already aggregated information that's been analyzed. Does that make sense?
Yeah,